Understandably, to harness the demographic dividend of our continent, we rely on the health and well-being of our young people, and so we must strengthen all the actors of our health systems to realize the goal of start free, stay free, AIDS free by the year 2020. Allow me to take this opportunity to share the Rwandan progress towards achieving this goal, starting with our strong commitment to start free through the EMTCT. As we stand now in 2017, the PMTCT services were fully available in, they are fully available in 96% of all the public health facilities, allowing a total of almost 350,000 pregnant women to get tested for HIV. And among these women, 0.7% have been tested positive, which decreased from 0.9 from the previous year. Among those women who tested HIV positive, 98.5% are on ART in the framework of our nationwide PMTCT program. And thanks to the VCT, we have now the male partners attending the antenatal care services together with their wives. And we registered 84.9% of the male who have attended and have been tested within 1 year. And as part of the continuum care of PMTCT services, 96.3% of HIV-exposed children born between July 2016 and June 2017, they have received ARVs prophylaxis at birth. An estimated 1.5 this year and 1.8 last year. So the rate of maternal child transmission continues to progressively decrease from the rate of 10.8% in the last decade. So Rwanda has also implemented early initiations of ART for HIV-exposed children. As of now, the median number of days between HIV tests to ART initiation is 2.5 days for those who are who are 0 to 5 years. And to stay free of HIV, the country continues to work towards a continuous decrease of new infections among children from 0 to 14, and adolescents mainly as a result of a PMTCT success. In fact, our 2015 DHS showed an HIV prevalence rate of 0.2% among children 0 to 14 years old, and the prevalence rate of 1% among the slightly old adolescents. With the scale-up of voluntary medical male circumcision program, the prevalence doubled between 2010 we had 15%, and by 2015 we had 30%, with more than 70% of the VMMC clients aged between 15 to 24 years old. In 2017, over 190,000 men were circumcised through routine services delivery and campaign, and an early infant male circumcision services have been integrated into routine maternal neonatal child health, as it's considered a long-term HIV prevention intervention. And to stay on track with the HIV-free goal, Rwanda adopted the WHO Treat All recommendations for HIV patients in 2016 as another way to increase the number of new patients on treatment. And today in Rwanda, 8,134 HIV-infected children from 0 to 14 are taking ARTs. An estimated almost 10,000, meaning 62% of HIV adolescents aged 10 to 19 are currently under treatment. And the second phase of All-In campaign, as supported by the UN, consists in analyzing the bottlenecks affecting coverage of priority HIV, sexual and reproductive health, and other cross-cutting intervention. So there is a health package offered at health facilities now proposing, that is proposed to HIV adolescent minimum package with mentorship and trainings related to better management of adolescents living with HIV. And at the foundation, at my foundation level, in line with the national health priorities in the past 16 years, we have since 2014 what we call the nationwide 12+ program, allowing the 11-year-old girls to attend mentoring sessions on health, education, and leadership in safe spaces. And to date, the foundation contributed to the graduation of over 30,000 girls, out of a total of over 90,000 girls graduating from this nationwide program. And at the foundation, again, we've been implementing for the past 7 years the Adolescent Sexual Reproductive Health and Rights program, allowing youth-friendly services to be delivered to hundreds of thousands of in and out of school youth, thanks to partnership between schools, health centers, peer educators, and youth club. As I conclude, I would wish to add that we believe in the lasting impact of empowering the youth, and we cannot afford to be complacent. So we continue to reinforce this concerted effort between all stakeholders of our healthcare chain, from our universal coverage, healthcare coverage that is at almost 86%, decentralized access to care, a network of 45,000 trained community health workers, to a health information system allowing the monitoring of data nationwide to further build on our current status that is on track at 87, 89, 93 on the 1990 goal. Getting impatient, Zainab? So, and to quote the former AU Commissioner, the extent to which African governments are able to transform education and skills development, health and well-being, empowerment as well as employment, So this is a call to all of us to further invest in our youth by really creating a very conducive environment to the young people to allow them to dream for self-actualization. So let us stay firmly grounded in our commitment to give our youth a strong health system and not hinder their ability to go beyond those great expectations we have for them and for our continent. Thank you.